In most cases, having sex during pregnancy is completely safe. For women with a healthy, low-risk pregnancy, there's generally no medical reason to avoid sexual activity. This is true across all 3 trimesters, though comfort levels and preferences may naturally change over time. Many people worry that sex might harm the baby or trigger complications, but the anatomy of the body provides multiple layers of protection. The baby is securely cushioned inside the uterus, surrounded by the amniotic sac and fluid. The strong muscles of the uterus act as a barrier, and there's also a thick mucus plug that forms in the cervix to help protect against bacteria and infection. These natural protections ensure that penetration or orgasm does not impact the baby in any harmful way. Furthermore, sex can offer emotional and physical benefits during pregnancy. It can strengthen intimacy between partners, help manage stress, and even promote better sleep. In some cases, it may even improve circulation and elevate mood due to the release of endorphins. Many couples find that their connection deepens during this stage, and maintaining a healthy sexual relationship can be part of that. Of course, every pregnancy is unique, so it's essential for expectant mothers to consult with their OB/GYN if they have any questions or concerns. But overall, for the vast majority of pregnancies without complications, sex is not only safe, it can be a healthy part of the journey. Listening to your body and communicating with your partner are key throughout. While sex is generally safe during pregnancy, there are certain medical conditions where it may not be recommended. In these situations, sexual activity could pose a risk to the mother or the baby, so it's important to follow a healthcare provider's guidance. One of the most common concerns is placenta previa, a condition where the placenta covers part or all of the cervix. In such cases, sex could lead to bleeding or other complications. Another important concern is the risk of preterm labor. If a woman has a history of preterm birth or shows signs that labor might start early, doctors often recommend avoiding intercourse to reduce any potential triggers. Unexplained vaginal bleeding is another warning sign. While not all bleeding is dangerous, it's a symptom that needs to be evaluated before continuing any sexual activity. If a woman has a weak cervix, also called cervical insufficiency, sex could potentially cause contractions or premature dilation. Similarly, if there's a leak in the amniotic sac or any suspicion of ruptured membranes, it's important to avoid introducing anything into the vagina due to the risk of infection. Women who have previously experienced a miscarriage may also be advised to limit sexual activity, especially in the first trimester. Ultimately, the safety of sex during pregnancy depends on the individual's medical condition. That's why communication with a doctor is so important. They can assess the risk factors and advise whether it's best to continue, modify, or avoid sexual activity until after delivery. There is a common concern among expecting parents that having sex during pregnancy might somehow harm the baby. Fortunately, this is a myth. From a medical standpoint, sex does not physically impact or endanger the baby. The baby is safely enclosed within the uterus, floating in amniotic fluid that acts as a cushion. The uterus itself is made of strong muscular walls that protect against external pressure. Additionally, a thick mucus plug seals the cervix throughout pregnancy, forming a protective barrier that blocks bacteria and keeps the uterine environment sterile. Penetration during sex does not go anywhere near the baby. The vagina and uterus are separated by the cervix, so no matter the position or depth, the baby is completely unaffected. Some couples worry that movement or orgasm could somehow disturb the fetus, but in a healthy pregnancy, this simply isn't the case. In fact, many women report feeling slight movements from the baby during or after intercourse, but these are usually normal and not a cause for concern. They are often responses to changes in the mother's breathing, heart rate, or body position. Importantly, orgasms can cause mild uterine contractions, but these are different from labor contractions and are typically harmless. In rare cases where a woman is at risk for early labor, a doctor may advise avoiding sex or orgasm. But for the majority of pregnancies, there is no physical pathway by which sex could harm the developing baby. As always, communication with your healthcare provider ensures peace of mind. Pregnancy brings a wide range of physical and hormonal changes that can directly affect a woman's sexual experience. These changes are completely normal and can vary greatly from person to person and even from one trimester to another. One of the most noticeable shifts is the increase in blood flow to the pelvic region. This happens because the body is working harder to support the growing fetus, and as a result, the vulva, vagina, and breasts may become more sensitive. For some women, this heightened sensitivity can lead to increased arousal and more intense orgasms. For others, it might cause discomfort or a feeling of fullness that makes intercourse less enjoyable. Hormonal fluctuations also play a major role in libido during pregnancy. Some women experience a surge in sexual desire, especially during the second trimester when morning sickness typically fades, energy returns, and the body has adjusted to pregnancy. However, others may feel less interested in sex due to fatigue, nausea, back pain, or emotional stress. These ups and downs are normal and should be openly discussed with a partner. By the third trimester, the growing belly and physical discomfort may make certain positions awkward or uncomfortable. Couples often need to adapt and find what works best for them. Side-lying or rear entry positions might offer more comfort and reduce pressure on the abdomen. Ultimately, a healthy sexual relationship during pregnancy is all about listening to your body, being patient with the changes, and maintaining open communication between partners. Pregnancy is often surrounded by myths and misconceptions, especially when it comes to sex. One of the most common myths is the belief that having sex can harm the baby. In reality, for women with low-risk pregnancies, sex is completely safe. The baby is protected by multiple physical barriers inside the womb, including the uterus, amniotic sac, and a mucus plug that seals the cervix. These layers ensure that the baby is well insulated from any physical activity during intercourse. Another widespread myth is that orgasms or sex can induce labor. While it's true that orgasms may cause mild uterine contractions, these are typically harmless and do not lead to premature labor. In fact, many women experience Braxton Hicks contractions later in pregnancy, harmless tightening of the uterus, that may occur after sex or physical activity. These should not be confused with true labor contractions, and they pose no danger in most cases. Some people also believe that it's inappropriate or even taboo to engage in sexual activity during pregnancy, especially in the later months. This belief is rooted more in cultural attitudes than medical science. Unless a doctor advises against it due to specific complications, there is no reason to avoid sex based on trimester alone. Emotional intimacy and physical connection can be beneficial for both partners during this time. In truth, understanding what is safe and what is not during pregnancy helps reduce unnecessary fear. Dispelling these myths empowers couples to maintain a healthy and reassuring relationship throughout the pregnancy. During pregnancy, it's important to be mindful of the risk of infections, particularly sexually transmitted infections, STIs, as they can pose serious health threats to both the mother and the developing baby. If either partner has an untreated STI, such as chlamydia, gonorrhea, syphilis, herpes, or HIV, engaging in unprotected sex can lead to the infection being passed on to the pregnant person. Infections like these during pregnancy can lead to complications such as premature birth, low birth weight, or even transmission of the infection to the baby during delivery. For this reason, healthcare providers often recommend STI testing early in pregnancy, especially for people with multiple sexual partners or a new partner during pregnancy. If an infection is diagnosed, treatment can often reduce the risk of complications significantly. In some cases, sexual activity may be paused, or condoms may be recommended to protect both the mother and baby. Even if both partners are in a long-term monogamous relationship and have no known infections, using protection may still be advised in certain situations, such as when the pregnant person has a weakened immune system or is dealing with a vaginal infection or inflammation. Additionally, if any symptoms like itching, unusual discharge, or discomfort arise, it's important to speak with a doctor promptly. Maintaining sexual health during pregnancy isn't just about avoiding discomfort. It's about protecting the well-being of both mother and child. With proper communication, testing, and precautions when necessary, sex can continue to be safe and enjoyable throughout a healthy pregnancy. From a urologist's perspective, there are no anatomical or physiological reasons that sex should be avoided during a healthy pregnancy. The male reproductive system does not pose any direct risk to the pregnant individual or the baby during intercourse, provided that there are no underlying health concerns such as sexually transmitted infections. In fact, from a medical standpoint, sexual activity during a normal pregnancy is not only safe but can also offer several benefits for both partners, including improved emotional bonding, stress relief, and even enhanced circulation due to physical activity. Urologists who specialize in the urinary tract and male reproductive health often encounter questions from expectant fathers who may worry about going too deep or causing harm to the baby. The answer is reassuring. The penis does not reach the uterus during intercourse and cannot come into contact with the baby. The cervix acts as a firm closed barrier throughout most of the pregnancy, and the uterus itself is a protected and sealed environment. Another concern from the male partner can be a decrease in sexual activity due to emotional stress or fear of harming the baby. Open dialogue is key during this time. Couples should be encouraged to talk honestly about their fears, needs, and any discomfort. A healthy sexual relationship during pregnancy relies heavily on mutual respect, understanding, and adaptability. In summary, as long as the pregnancy is progressing normally and under appropriate medical supervision, there is no urological reason for abstaining from sex. It's a natural, safe part of a connected and healthy relationship. When it comes to maintaining a healthy sex life during pregnancy, one of the most important factors is open and honest communication between partners. Pregnancy is a time of significant physical, emotional, and hormonal changes, and these can affect sexual desire, comfort, and expectations. Some people may experience increased libido, while others may feel a complete lack of interest in sex due to fatigue, nausea, anxiety, or body image concern. These variations are normal and expected, but they can cause misunderstandings if not openly discussed. Couples who communicate their feelings and needs tend to navigate these changes more smoothly. For example, if one partner is feeling discomfort during intercourse or is emotionally overwhelmed, expressing that clearly and respectfully helps prevent frustration or guilt. On the other hand, partners who are feeling disconnected may find that talking about intimacy, even beyond just sex, can help strengthen emotional closeness. It's also important for both partners to be flexible and sensitive to each other's experiences, adjusting sexual positions, exploring different forms of intimacy like touch, massage, or cuddling, and being patient with changing moods can help maintain closeness throughout the pregnancy. If either partner feels unsure or worried about what's safe, consulting a healthcare provider can offer reassurance and guidance. Maintaining a sexual connection during pregnancy isn't just about physical activity, it's about reinforcing trust, emotional safety, and mutual care. With clear communication, couples can support each other through the ups and downs and continue to feel connected during this transformative phase of life.